An otoplasty is a surgical procedure which pins back a protruding ear. The best candidates for this type of procedure are people who have a complex about their ears, particularly when they stick out markedly. There are various degrees of protrusion which can occur to the point where they can actually point forwards. This obviously leads to a lot of classroom teasing and even teasing in later adult life. And these are the best candidates who will accept a marked improvement. The only contraindications really for this procedure are if there isn't a recognised problem, or patients expect or have unrealistic expectations, or they're medically unfit. It's not necessary to see your GP, and a referral to a competent surgeon by word of mouth through a relative, a friend, or a past patient is more than adequate. Preparing for an otoplasty, as with any cosmetic elective surgical procedure, it is advisable to do as much background research as possible, a lot of information on the internet, background reading, and then it is important to select your surgeon very carefully. Make sure that you're happy with him, that he empathises with you and understands what you're looking for. It's important to know that he'll be there to look after you after the operation. And once you've done your homework carefully, then go and read up about it again. You should be given some written information by the surgeon, and then make an informed decision to proceed. There are variations of this operation. The essential part of this procedure is to reshape the cartilage, because the ear is an outpouching of cartilage from the side of the head, which is covered by skin. And once you can reshape the cartilage, the skin will redrape over it. So the principle of this procedure is to expose the cartilage, usually through an incision at the back of the ear so the scar can't be seen, and then the cartilage is reshaped. And there are various different techniques or variations thereof according to the problem at hand and the patient specifications, which you have to adhere to, and then the skin is then redraped and stitched back with dissolvable stitches. Afterwards, a bandage is placed for 24 hours. This is not to pin the ear back, this is to reduce bleeding, bruising and swelling. The bandage can be taken off after 24 hours and the patients can go home without a bandage, but it's important to wear a bandage at night time to protect the ear from trauma whilst you're asleep. Once the patient is on the table, this can be done under local anaesthetic and sedation or general anaesthetic. Usually young children are done under general anaesthetic, and much older children and adults usually sedation and local anaesthetic. So without any pain, an incision is made behind the ear or in the groove behind the ear. The skin is then mobilised or lifted off the cartilage. The cartilage can then be reshaped according to the specification. Dissolvable stitches are inserted to reshape the cartilage, and then the skin is sutured back in place with a dissolvable stitch. The procedure usually takes between half an hour to 45 minutes. The only pain that's experienced is if you're performing the operation under local anaesthetic, and that's just the initial stinging effect of the local anaesthetic. Once the anaesthetic has taken effect, then there should be no pain or discomfort. When the anaesthetic does wear off, there may be some discomfort, and this is usually treated with the appropriate medication afterwards. After the operation, expect some bruising and swelling of the ears, which should last between 10 and 14 days. There may be some minor bleeding from the incision site, which isn't usually serious. Occasionally, infection can set in, but this is usually treated with antibiotics. People who can cover their ears with their hair, which is usually females, they can go back to work a lot sooner because usually they're in sedentary jobs, so within a few days. Someone who's usually males who can't cover their ears will probably wait a week or two before going back to work. Usually the incision is made behind the ear, And with the ear pinned back, it's very difficult unless you pull the ear out to view the scar. It's usually not noticeable at all. Once people are discharged home, they're given some post-operative instructions. They're advised to sleep upright. They're given a bandage to wear at night to protect the ears while they're asleep so they're not pulled. They're usually given a course of antibiotics and occasionally creams to put in the groove behind the ear. You can wash your hair every day as long as you dry it carefully with a cotton bud in the groove behind the ear, and you can apply some antibiotic ointment or cream. And then once the healing has taken or completed, which is usually about a week to 10 days, there's no need for further bandages, and then just wait for all the residual bruising and swelling to settle. The main risks of this procedure are infection, inadequate correction, an unfavourable result. From an otoplasty, you can expect a normal looking ear which is in the correct position. In the vast majority of cases, it is a one-off operation, and it's not usually performed with other procedures, although occasionally people ask for a rhinoplasty at the same time. That's perfectly feasible to do that together. I've come across all sorts of weird methods of pinning back ears, from double-sided sticky tape to super glue. The problem with these is that it will lead to skin irritation. You can always know how severe a person has regarded their condition by the amount of skin damage that they present with, because of the longevity with which they have these irritant products close to their ear. The person who should perform an otoplasty is a qualified surgeon who performs these procedures on a regular basis. The cost of this procedure can vary between £2,500 and £3,500, depending on whether it's done under general or local anaesthetic.